Good evening, everybody. My name is Candace Piper, and I'm an RN nursing student, and I'm here to talk to you a little bit about blood pressure, what it means, and how it relates, and why it's important. So, first I'm going to talk about what is blood pressure. So, it is the definition by Ralston and Goldsworthy 2010 is the pressure exerted by blood on the walls in your arterial system. So, most of you probably know it's two numbers. It's something over something is how the nurse or the doctor will give it to you. So it's your systolic over your diastolic. The systolic is the peak pressure when your heart contracts, and your diastolic is when your ventricles relax. Your ventricles are the two bottom muscle chambers in your heart. It's measured in millimeters of mercury, and how it works is you use your stethoscope and your thermometer, which involves your cuff and your pressure gauge, just to measure it. And that's really all you use, and that's the easiest non-invasive way to measure it. So Mosby's dictionary says, in the aorta and your large arteries of a healthy young adult, blood pressure is approximately 120 millimeters mercury during systole and 70 millimeters mercury during diastole. That's why a lot of people say that your blood pressure should be 120 over 80, but that's not completely accurate because we're all very different. There is a healthy range, and the higher your systolic blood pressure is, the more dangerous it can be, but we are all different. So why it's important? Like I just said, the numbers and how they change, and they do change a lot throughout the day, but that's why we measure it so often, so that we do know how the blood pressure works in there. So I brought this along today to just give a little bit of a visual demonstration of the hose is attached to this, and it was clogged with dirt and grass and slugs and everything else. How much water would come out? Which not very much would, right? And that's just exactly like our arteries are in our body, and if they're clogged, that's how a heart attack or a stroke or something like that occurs when blood pressure or when blood a blockage or something occurs. Now I'm going to go into how that relates to a stroke. Knowing your blood pressure decreases the risk of you getting a stroke. Stroke is the third highest cause of death in Canada, following behind cancer and heart disease, I think. And blood pressure, knowing your blood pressure is the easiest way to figure that, or figure out where you're sitting with that. So there are things that you can change about your risk factors to help you decrease your risk of a stroke. You know what some of your ones you can change are? Like blood pressure? Exercise? Exercise, yeah. Stress. Yep, perfect. High blood cholesterol, if you have heart disease, atrial defibrillation, if you have diabetes, it increases your risk immensely. If you're overweight, if you intake a lot of alcohol, if you're physically inactive, if you smoke, and then stress. So, and non-modifiable, right, the things that you can't change that might increase your risk of getting a stroke are age, your gender, your family history, your ethnicity, and your health history. If you've already had a stroke, can't really change that. So, it's important to remember the things that you can and can't change and how to deal with that. So, there are 5 warning signs of stroke, and they try and advertise that so it's easy on your hand to remember. Does anyone know any of them? Dizziness? Yep. Dizziness? Weakness? Yep. Usually the one side of the body. Headache, vision problems, and trouble speaking. So people often slurred. Same with it's just the muscles on one side of the body. Yes. Okay. I'm just going to do a quick demonstration of how to take a blood pressure and how easy it is and what it all means, just to kind of make sense of something. You get one strapped to you in the hospital. So I've got Randy here. She's going to lend me her arm. You can relax on the table for me. Thank you. So the brachial artery is right in the arm here. And I just gotta keep it firm there, and the cup is in the proper size. That's really important to get a proper reading. It'll still work, but you're gonna not get an improper measurement. So I'm gonna pump this up to usually 140 or so millimeters of mercury, just to get it a little above, and then I'm gonna listen for when our heartbeat starts to come back in. There's gonna be a little bit of pressure. Okay, I got 122/78. So I stopped hearing the blood coming through her artery at 78, so that's when I saw when her ventricles relaxed. So that's that number means, which, like I said, changes depending on a lot of things, right? When people talk about your blood pressure increasing, you get upset, right? So I think that's about all I have for you today. So I just brought this again to say that next time you see those this summer, just to remind yourself that take care of yourself, and that your blood vessels may be really small, but they all lead to your heart, and it's important to keep them clean. So are there any questions?
And you said that there was other ways to take blood pressure, but they're more like invasive. What are some other ways to take blood pressure?
You can get like an indwelling catheter, I think. Again, there's more information in some of the sites I found, but yeah, I think that when they talk about that, like people that need to keep a constant eye on it, they're going to get that. They're not just going to have a blood pressure machine hooked up to them, they'll have like an indwelling catheter.
I'm sorry, one more. When you're pumping up the gauge, like if someone's feeling pumped up to 140, but someone had like really high blood pressure, like if it's 145, would you not get that reading then?
Yeah, if I start to hear it right away, then I let it go again and then pump it up. Yeah. Yeah, good question. Usually they teach us, I guess I didn't do it exactly, they teach us, but to count your radial pulse first, so that you know about how high to pump it up, but you know that everyone's on average 130-ish, you know, so pump it up around 150.
Even kids?
No, kids is usually a little bit lower. Yeah. But babies is really low. Pulse is really. Yeah. Any other questions? Thanks for listening.